Primary sample collection and handling. General, the lab shall have documented procedures for the proper collection and handling of primary samples. Documented procedures shall be available to those responsible for primary sample collection whether or not the collectors are lab staff. Whether user requires deviations and exclusions from, or additions to, the documented collection procedure. These shall be recorded and included in all documents containing examination results and shall be communicated to the appropriate personnel. Note 1. All procedures carried out on a patient need the informed consent of the patient. Most routine lab procedures, consent can be inferred when a patient presents himself or herself at a lab with a request form and willingly submits to the usual collecting procedure. For example, venipuncture. Patients in a hospital bed should normally be given the opportunity to refuse. Special procedures, including more invasive procedures, or those with an increased risk of complications to the procedure, will need a more detailed explanation and, in some cases, written consent. In emergency situations, consent might not be possible. Under these circumstances it is acceptable to carry out necessary procedures, provided they are in the patient's best interest. Note 2. Adequate privacy during reception and sampling should be available and appropriate to the type of information being requested and primary sample being collected.